This is Carl with Assisted Living Facility Rookie. Good to see you guys. I have my very good friend here, Mr. Noe Perez. Can you tell us about yourself? Yes, we're eating. It's a little bit different.
Hi everyone. Hope you guys are having a great day.
Mhm.
So we are here at the Masis. This is still part of Houston, right? Houston area.
Oh, Houston, Katie.
Yeah, very informal. Anyway, my name is Noe Perez. Quick background about myself is I actually have a degree in IT.
Okay.
So I graduated in the Philippines in 2003 with a bachelor's degree of systems analysis and design.
Mhm.
And I came here to the States, just like everybody else, immigrated, having to dream of having the American dream,
Uh-huh. I love that.
right?
I love that.
So, said it so many times, coming from a humble beginning and working in the home health industry for about 21 years now. I do own a home health agency,
Yes.
hospice agency, and an assisted living facility. So I've been in the outpatient setting in terms of taking care of patients, post hospital discharge, going into 21 years now.
You have a
Um,
wealth of experience for sure.
I try.
Yeah.
So, my home health is Home Care of Texas, and we are one of the few preferred providers of, I'm not going to name the hospital, but
Yes.
it's a major hospital here in Houston.
Yes. Yes.
And we take care of a lot of patients, basically, that are being discharged, from the hospital, regardless of what their condition is. We have the capacity and the bandwidth to take care of them. So we cover a whole large of area, cover from all the way up north to the south, all the way to Galveston. We have patient that goes all the way to Brenham, Texas.
Mhm.
East side, we go as far as Anahuac.
Wow.
Yeah, we go as far as Anahuac, even farther than Anahuac. I don't know if you guys have heard of ha- Hankemeyer. Uh,
I'll definitely put a map on
yeah,
the
I'll
video
put a
so
map
people
in
will
there so you
see.
can see.
Yeah.
Then on the west side, we go as far as Sealy. We have clinicians. Well, I train the clinicians, so we specialize in left ventricular assistive device, the butamine, Primacore, pretty much anything that you can think of. We do that at home in the home setting. So yeah, and I recently graduated as a family nurse practitioner,
There
just
you
like
go. There
Carl.
you go. There you go.
So yeah, and that's a little bit of background. I guess that's a little bit of background.
Yeah, that's a lot of stuff. I feel like you're definitely an essential piece to the assisted living facility puzzle, which those are the people I try to bring into the show.
Sure.
And like home health are the number one people that you want to work with because
Hmm.
there's patients in your facility and they need help and services that you yourself aren't providing. So home health or somebody needs to provide.
Correct. Correct.
So definitely a number one guy that you want to reach out to. Um, I'm a little biased. I do trust Mr. Noe Perez more than any other home health. I've also known him more than any other home health as well. So
Yeah, I
highly recommend
mean,
it.
we've worked in a couple of home health agencies too.
Yeah.
So yeah, so my background, where I came from.
Mhm.
Yeah, so fire away. What's your questions?
Well, you answered a lot of it already, but what is one challenge that you faced recently, and was there a solution?
Well, staffing has always been an issue.
Hmm.
Staffing is always going to be an issue regardless of where you go, right?
Hmm.
Whether you own an assisted living facility, a home health agency, a hospice, you will always have the struggle, just like hospitals, of having staff. Now, that's everyone's problem.
Hmm.
My biggest problem is staff that actually wants to work,
Okay.
that have the passion for it.
Hmm.
Because whenever you have a staff that just wants to work and doesn't have the passion for it, you don't expect them to last that long.
It's true. It's hard work.
Yes,
hard
and training people, you know, trusting them is a big thing. Another biggest problem is, of course, when you train them, you exert effort, energy, financial means.
Mm-hmm.
So you gotta be able to kind of spot check who's gonna last in this type of business, right?
What's
And
what's one thing that you look for in a staff that kind of shows you like, oh, this person's not gonna last long, and then one thing that shows actually this guy will last a long time. He has good character. He has good characteristic.
that's a very, very good question because you have a lot of people that would just apply.
Mm-hmm.
Believe it or not, right now there's probably 3 applicants
Wow.
for nurses for our home health agency,
Yeah.
and I think there's three caregivers that wanted to go into the assisted living facility route.
Okay.
One thing that I asked them actually is not skills. I'm not a big skill person. Maybe because I know I can teach that the proper way, but it's more on character,
I like that.
right?
I like that.
I don't ask them about what can you do, what do you do, and things like that. And I don't judge people based on what happened to them in the past. We all make mistakes, and we're all just humans. You're gonna have situations where you made a bad decision. Guess what? I did it too. When I was younger, I made a whole lot of horrible decisions,
Yeah, we all did. Yeah.
right? But my biggest thing is character. So what involves a good character, right? So I have this bunch of questions that I ask clinicians. Giving them scenarios on things like that. It really depends on what their answers would be. But like when I do interviews, I don't interview on what your experience is like, things like this. It's more personal when I go in depth to interviewing somebody, and also based on how they struggle in life
Okay.
is my biggest wow factor.
That's good because they know if they've struggled, they're hungry.
If I have an applicant that I know that's hungry, that really struggled in life, I know they're gonna value the work, and I know they're gonna value the patients. I mean, there's always that exception, right? Exception to the rule. So as you go on to that interview process, you kind of get a hint on how this person would be, and doing what I do, what you've done as a nurse practitioner, you've met so many people along the way, so many family members, so you would have an idea on how this person would act on a certain situation.
Yes.
Right? And another biggest thing, of course, is critical thinking. Right? Critical thinking is a big thing. And you know what's funny is that I just said it today to actually one of my patients. If I can buy common sense at Walmart, I would have sold it already and made millions of dollars.
You would. You definitely would. Billions, billions.
Yes, because I mean, for whatever reason, common sense is not that common anymore. And again, that's just a biggest struggle whenever you're dealing with people. I'm not looking at the bad things, but there are certain situations that accountability should come into play. So if a person doesn't have an accountability, doesn't have the common sense, guess what? That's going to be a problem for you. Really going to be a problem.
I think that's the thing with home health. Like, a kind of character kind of goes hand in hand with accountability, because no one knows what you're doing. No one's going to be over your back. So you have to do what you're going to say you're going to do, and then just have like a moral accountability. Even
Correct.
like, hey, yep, I did it. I did a great job. Like no one's going to see what I did, but this patient will be better because of it.
And one thing that I've learned through the home health setting, assisted living and home health, is that yes, you're right. Because you're literally, when you go to those patients' houses, who's the boss? The boss is the patient. If your doctor is happy, your doctor is not going to care about anything. They're going to care about the care of the patient. But whatever you do there, it's going to be credibility wise. But one thing I know is that when patients speaks, they talk to the doctor, they talk to the case manager, the word of mouth is extremely priceless.
Yes.
Your credibility out there is extremely priceless. So with that being said, we always want to make sure that what we put out is what we actually do. At the end of the day, it's gonna bite you in the butt, and then guess what? Now you just lost a doctor. Then that doctor's gonna speak to another doctor, then you just lost two doctors.
More than that, the doctors talk.
Oh yeah, they do.
They talk quite a bit. So,
Yeah, yeah,
so that's a great challenge, and that's a great solution. I love that, Noe.
yeah.
Well, in terms of how does someone get in touch with you to work with you? Like, what would I need to bring, or what information would I need to provide? Work with you in terms of as a patient, and then work with you as in terms of like another person trying to get clients for an ALF. How does that process look like?
So, are we talking about ALF only?
Yeah, let's just focus on ALF.
Oh, ALF. Okay, so our assisted living is called Serenity Haven at Mossy Oaks. It is located at 23003 Fritz Lane. That's in Spring. And with that, usually what they do is they send us an email. That's admin at serenityhaven at mossyoaks.com. And you can check out our website too. It's www.serenityhaven at mossyoaks.com.
I'll let you put those email and the links in the show notes. For
Okay,
sure.
correct. So usually we would get referrals.
Okay.
And once we get the referrals, there's a pay sheet that we have. Senior placement agency would fill it up, or patients can fill it up themselves, and then send it to us. What I do is I come out and do an assessment, a proper head to toe assessment. It's not just your regular assessment that a clinician or not. Sometimes clinicians, actually administrators that are not clinicians, or case managers or office managers, they do those kind of assessments.
They can.
They can.
Yes.
But with us, we want to get a proper assessment that's in a clinical aspect, and also with the family. So that way we have expectations, we have care plans being set, and then we have this individualized care plan that we give to every patient that we have. We cater the diet, whatever the patient needs and whatever the family wants them to have, we cater those things.
Okay.
So with that face sheet, our information's there. They send it to us. I go in, I do my assessment. Then after that, if the patient qualifies and we can provide, the most important thing here is providing the services that they need. I am not the one that's gonna force an issue. If I cannot provide it, I'm always honest. I tell them, look, this is something that I'm not comfortable with. I have a team that can help you find another place for you. So whenever I accept a patient, I know I can take care of it. I know I have the capacity and the bandwidth to take care of it. Because at the end of the day, guess what? It's always the patient's health.
Yes.
And if we can't provide the care, then we're shooting ourselves in the foot. There's just a whole lot of liability there. So once that's done, then I let the family and the patient, if they're able to, come and visit my facility.
Okay.
We give them a tour, we get them comfortable, we show them where their room is gonna be at, and then from there the rest is history.
One thing I do want to point out that's unique, I think it's unique regarding your facility, is that I've been there and I've seen it, but your staff are all trained to be not nurse managers, assisted living facility managers.
Yes.
They're all trained, so
Yes.
they're all, I would say, exceed the normal training that's usually given to staff. Like, not just the manager is trained, but like all the staff from top to bottom is trained in the ALF manager role.
Yep.
So that's one thing I want to point out as well. Like, education is important to your company, and then character. So those are the two things that I feel like a vulnerable population really needs.
And what I do, and my staff, all of my staff knows this, in the home health, hospice, assisted living, is that I'm a big proponent of learning, of school, of lifting yourself up, getting to the next level. I have a couple of caregivers that are actually now looking into LVN school.
That's excellent.
So I give them incentives. If they wanted to go study, hey, by all means, I'll be your number one cheerleader, because I love it when people strive for more, and I love it that they have the passion for it.
That's great. Yeah. That's great. And then in terms of the home health, how can they reach you for the home health for services? Like, is it usually just through the physician referral? Like, what do they need to tell their physician? I want this guy to be my home health.
So with the home health setting, this is a little different because then it requires a doctor's referral or a signature, right? But usually, what patient does is they would call my office, and they would say, "Hey, look, I need home health," and then we would tell them what we need is now this is Medicare rules,
Yes,
right?
yes.
So what we need is a referral from a physician saying that the patient needs home health. That's one. Number two, we need a face-to-face visit, meaning that they should have been seen by their primary care or their specialty doctor within 90 days
Okay.
before we admit the patient, and or 30 days after the admission is done.
Okay.
Next is we need a history and physical of what the problem is. And that problem needs to have a valid diagnosis. If there's no diagnosis there, then that patient may not qualify for home health. Next is that patient needs to be homebound. So what do we mean by homebound? Homebound means that the patient, number one, is not driving. They leave the house only if it's needed. They have the ability to drive if it's about doctor's offices, if they're going to go to the doctor, or go to the pharmacy, or go to church, as long as it's infrequent and it's not because I want to go to the mall and shop.
Okay. Makes sense.
You know?
Makes sense.
So that kind of disqualifies you from being homebound. And of course, if there's a skill that's needed,
Okay.
whether it's wound care, whether it's medication management, teachings, that kind of thing.
Okay.
Yeah.
I love that. For home health, what is the best way to reach you for home health?
Oh, that's right. The best way to reach me is you can go to our website. It's www.homecareoftexas.com. Our phone number is 281-602-0800. You can also email us at admin@thehomecareoftexas.com. Fax number is 281-602-0806.
Awesome. Awesome.
Yeah.
Well, thank you, Noe. Thank you so much for your time. Thank you so much for your service. And thank you so much for this wealth of information you've given our viewers here today. Thank you so much.
Thank you so much, Carl, for having me here. It's been a pleasure.
It's a pleasure.
All right.
Thank you.